Welcome back, everybody. We are here with Dr. Kelly Ballantyne for a question and answer, and a lot of awesome comments and questions came in through Twitter, so we'd like to chat with you about them. All right, so feeding off of your talk, you mentioned a whole slew of moderators of behavior.
Right.
There's not one reason behavior happens,
Right.
it seems.
Mm-hmm.
So from your clinical experience working with people and their dogs, what do people generally seem to consider on their own as a moderator of behavior, and what do they possibly generally miss?
Right, that's a great question. So I would say that the thing that I see most in my practice is our natural human response to an undesirable behavior is we want it to stop. Mm-hmm. And that means we might yell at our dog, or we might give them a physical correction with a leash, or do a whole host of things in order to stop the unwanted behavior. Mm-hmm. And I think, and while there are a lot of people that also use positive reinforcement, or they might say, oh, my dog's scared of this, I'm going to try to add something positive into the environment to improve the way that they feel about it. What I see people miss the most is the importance of managing the environment. Mm-hmm. So I would give you one example in that we see a lot of dogs that might bark in response to people walking by the house. And that's a pretty normal behavior in dogs. We can see some extremes in that, like dogs breaking their windows in response to people passing the house. But that behavior is in response to a very specific environmental cue. Here goes this person passing the house. The dog barks in response to it, and the person goes away. Exactly. So every time the dog has the opportunity to see that environmental stimulus and respond in that way, their behavior is reinforced. And sometimes doing something as simple as going to a hardware store and getting some adhesive window frosting and covering the site of that person passing by the house makes that behavior irrelevant. They don't engage in it anymore.
Yeah,
so
that's a great environmental example.
Yeah. So I think just controlling the animal's environment and limiting their opportunity to engage in the unwanted behavior is the big thing that I see people missing a lot.
And it's an interesting point because we also are constantly controlling our environment. You know, we take our jacket off and on, and you know, we're just doing things that make ourselves more or less comfortable, but we're not thinking about it for our puppy dogs.
Right.
Yeah.
Exactly.
Yeah.
We've had so many great questions coming through on Twitter. Dale has asked, I guess, how much training are just regular general vets getting in behaviour these days at the moment? And using the example of sometimes a dog trainer is brought in to work with a dog and an owner, or a situation where perhaps aversive training techniques have already been recommended by the vet, and then the awkwardness that kind of puts the trainer into. So,
yeah, it does. It is a very awkward situation, and I've been in that situation myself too, you know, where I might have a client that's coming in that's gotten some recommendations from their veterinarian about aversive training methods. So to answer your question, how much training do vets get in behavior? It honestly at this point still really depends on where they go and get their veterinary training. So there is definitely a need for more behavioral education in veterinary schools. So very few veterinary schools have a veterinary behaviorist on staff. And actually one of my colleagues, Dr. Calder, did a study along with one of my really good friends, Dr. Cook, where they were assessing like how prepared fourth-year veterinary students feel to deal with behavior on day one into practice. And they don't feel well prepared at all. So it is a huge problem. It is something that, you know, myself and my colleagues who work in the veterinary schools are really trying to help. You know, so for example, at University of Illinois, where I work, we have veterinary students that are able to rotate through my clinical practice. So they're seeing cases with me. And then I'm also teaching classes in the core curriculum that all of the veterinary students get, as well as teaching an elective. And there are some schools that even have way more in terms of a behavioral curriculum, but there are also some schools that don't have a behavioral curriculum at all.
Okay, so quite a lot of variation.
So, and also if you're a veterinarian, your access to behavior, just to spell it out, might it be natural behavior, behavior modification, and then behavioral medicine? You know, is there another component, or is that kind of the three main areas that you might consider?
Yeah, I mean, I think that those are the three main areas that we try to cover. So those of us that are in the academic institutions, you know, we want to teach our students what normal behavior is. We want to teach them about how animals learn and how they can modify behavior. And then we also want to teach them about like medical influences on behavioral issues and when medications are indicated and talking about fear and anxiety. So
And also pain and
pain.
Yes.
Yeah,
So,
absolutely.
so a lot that they could have access to in the veterinary.
Yes, exactly. I mean, I think veterinarians they need to be an important component of assessing behavioral problems because those behavioral problems could be driven by a medical condition, right? So we have to have trained veterinarians so that they can assess those animals and make sure it's not a medical issue.
Right, right.
And are there, I guess, how widely spread are veterinary behaviourists in terms of, you know, either regular veterinarians referring them on to a
Right.
veterinary behaviourist? Are they widespread? Is there a shortage of them going around? You know, how common is a specialist?
Yeah, so we're still a very young specialty. So this is actually our 25th anniversary as a
Happy
specialty.
anniversary.
As a specialty college. So that's very young when we compare it to other specialties like internal medicine or orthopedics. And there aren't that many of us veterinary behaviorists. So I think at this point we might be now at 80. Don't quote me on
that's
that.
in the US.
But that's in
Yeah.
the US, although some of those boarded vet behaviorists, like there's one in Australia, there are a few in Canada, and then we have some over in Europe. So not all of those 80 are practicing in the US.
Right.
And there are many states that don't have veterinary behaviorists within the state. And so access is a huge problem. I know that some of my colleagues, like Dr. Radasta, who's down in Florida, she does a telemedicine service. So referring veterinarians can call her and get a case consultation so that those pet owners can get help.
And isn't technology great?
Yeah,
In the, you know, Skype and what we can
absolutely.
actually do.
Yes,
As an enabler.
It does, absolutely.
And just for our general viewers at home, if there is, how do you work, or how do vet behaviorists tend to work? Is it, do you work with a particular trainer? Does the trainer have a particular background in behavior modification? How does it often play out?
Yeah, that's a great question. And it's going to vary between veterinary behaviorists. I have kind of a mixed model. So, you know, I'll see patients for consultation, and then those patients, if the owners are pursuing behavior modification, they'll either be coming back and working with my veterinary technician, who's also a certified trainer. So they'll come in and work with her. Or if we have been referred to from a trainer, then the trainer is going to help the client to implement the training recommendations or the behavior modification exercises that we're recommending. So we usually do a lot of collaboration with our local area trainers. And I know that there are a lot of veterinary behaviorists that have very similar models. Yeah.
Leading on to that, we did have a question that asked, what part does memory play in dog behaviour?
Oh, right. Yes, and memory plays a huge part in dog behavior. And specifically, you know, where I always think about memory is memory of fearful experiences and the way that our brains are kind of programmed to respond fear. I mean, it's an adaptive thing. You have to remember when you're in a scary situation. So if you're in a similar situation in the future, you're ready to either defend yourself or run away. And so that kind of learning and memory is really hard to change. So, yeah.
And there's been some recent research, hasn't there, that showed, particularly for dogs, the importance of getting rest after a learning session.
Oh, yes,
Is that
right.
right? Like the importance of having just some downtime
Yeah.
to sleep or rest and consolidate
Right, and
a learning
consolidate.
experience.
Absolutely.
Yeah, which I thought was fascinating. And so important, I think, in this time where we're really conscious about enrichment and giving dogs lots of things to do, to remember that actually one of the things they have to do is do nothing, like have a little bit of downtime and rest time,
Right.
not be too overstimulated.
Exactly. Yeah. And I feel like sometimes we don't appreciate how sedentary dogs can sometimes be. I mean, they spend a huge part of their daily time budget resting, and so many dogs are just overstimulated, where they might be at a daycare all day long, just going, and then they're exhausted when they get home.
Daycare hangover.
Yeah.
Can relate. We also had someone asking, let me just, find the right person, came through on Twitter, given that early life deprivation impacts behaviour and dogs may end up in rescue from these sort of situations. What approaches are effective for owners and or rescues to do to increase these dogs' resilience?
Oh, that's a great question. I don't think we know enough information yet to give specific prescriptive recommendations there. I think that that's a really interesting area of research, absolutely, because resilience is an issue, and we want to make sure that these dogs are in the appropriate environment and getting the appropriate levels of care, maybe being protected from certain experiences, or really using like gradual exposure to scary situations so that they can thrive as best as possible. But I don't think that we know enough about that yet.
Yeah.
And has there been any new research coming out? I guess you're particularly interested in the human-animal bond and how it relates, I guess, to behavioural problems, but has there been anything new that's come out that's really taken your attention lately, or in the research field, or I guess in your own practice, something that you've done that you found was like an aha moment, or, particularly of interest?
Yeah, that's a great question, Mia. I mean, I think, whenever I'm reading the research, I'm always looking for different treatments or different ways of modifying behavior, and that's the thing that really piques my interest, because I'm always looking for newer and perhaps better ways to help the people and the pets that I interact with on a regular basis. The cognition studies are always really, really fascinating, and it gives us, I feel like, a window into how our dogs are perceiving the world and how they think. So I think that's pretty cool.
And that's something that probably the average dog owner, is it fair to say, often misconstrues? Like we tend to think that dogs are perceiving the world the same way we are. Like that's our default,
right? Of
we
course.
tend to over-prioritize the visual, not think so much about things from this level of the environment and what it looks like to a dog and those kind of things. So it's a really important factor, isn't it, for the average dog owner to get not down on four paws, but you know what I mean.
Right, think about the world from their dog's perspective, and also, giving them the time to investigate the environment. I know one of the trainers that I work with, she had a client who said, when talking about taking her dog out on a walk, she's like, well, this is her newspaper.
Right.
Like, this is how she's getting the information about the world, and
Yeah.
giving her time to just explore and get that information, read the daily news is so important.
Yeah. Is a sniff walk or something like that, like if someone's at home watching now and they want to know just one thing they can do to really help their dog lead a happy life, is there just one thing like that you would say prioritize letting them have a sniff, or give them the option of being inside or outside? Is there any one little hot tip that's your go-to favorite?
I mean, I always hate to make generalizations because there's always exceptions, and walking is commonly recommended as something like, if you do anything, just get your dog out on a walk, and it gives them a lot of really important enrichment. But I also meet a lot of dogs where going out on a walk is terrifying. And it creates so much stress for them. So we have to figure out a different way to give them enrichment, and that might be doing stuff in the home, like doing some training with their person, or using interactive puzzle toys to give them a little bit of mental exercise.
Yeah, so maybe the tip that you have is consider your dog as an individual.
Yes.
Or each of your dogs as an individual and what they would most appreciate.
I couldn't have said it better.
All right. Well,
I think we'll wrap up for right now.
Okay.
And thank you all for tuning in for the Q&A, and we will be back in 5 minutes with the second part of Dr. Kelly Ballantyne's talk. Thanks so much.